Those dealing with the consequences of being operated on by Ian Paterson arrived to hear the findings of the inquiry into his malpractice. But even they had no idea just how many people had been affected by the scandal.
Once you were in his hands, it was all about how he was going to make money.
There is no doubt that the NHS and the private sector have failed us.
I'm expecting the government to do something, not just words.
Ian Paterson was jailed in 2017 for carrying out unnecessary operations on people in private hospitals who didn't even have cancer. In the NHS, he was performing his own version of a mastectomy where he left breast tissue behind. Today, it's emerged Ian Paterson saw more than 11,000 patients over 14 years, 6,500 in private hospitals and more than 4,000 in the NHS. The report recommends that all patients should be reviewed if they haven't been already. It also says private hospitals should take responsibility, as the NHS does, when things go wrong, and a database of consultants' performance across England should be available for patients to check.
Well, my report sets out what can only be described as willful blindness in relation to Paterson's behaviour and aberrant clinical practice. Colleagues avoided or worked around him. Some could have known, others should have known, and a few must have known.
Barbara Lewis had a so-called cleavage-sparing mastectomy. Her cancer has returned and spread.
His actions have led to the deaths of patients, in my mind. And he's given me a death sentence, and my husband, he's took our lives away.
As the inquiry report was delivered to Parliament, the government apologised to patients who'd given evidence.
Their testimony in this report makes harrowing, appalling reading. As such, it is with deep regret that we acknowledge the failure of the entire healthcare system to protect patients from Ian Paterson's malpractice and to remedy the harms.
The last time we saw Ian Paterson, the day before he was sent to prison, he refused to answer any questions about his practice.
Mr. Paterson, have you got anything to say to your former patients? Any reasons why? All they want to know is why, Mr. Paterson.
The inquiry has referred 5 colleagues of Ian Paterson to the medical authorities, and 1 case is being reviewed by police. Spire Healthcare and the NHS support the recommendations, but for those living with the consequences of Ian Paterson's surgery, they still await real change. Stacey Foster, ITV News, Birmingham.